So we started this project with Joe really from the very beginning. It was actually a very small gift that Austin and Joe pulled together to begin this research, which we hadn't done before. We'd been stimulating the spinal cord in our animal models. We've been doing physical therapy and occupational therapy to help patients recover, but we had yet to combine the two. And it was really, Joe was the first participant where we used this unique high frequency waveform to apply electrical stimulation to the surface of Joe's skin over his spinal cord. So we were activating the spinal cord without requiring surgery in this case. And what we saw was something quite dramatic. We saw Joe's function recover over just the period of a month, from barely being able to move his fingers or bring them together to being able to grasp objects and feed himself. And the most exciting thing about this graph is that for a full 3 months afterwards, as long as we could measure, Joe retained all that function. So the stimulation wasn't required. There was some type of neuroregeneration that was happening. And that caused us to follow up with another study where we reversed the orders of the interventions, really well-controlled randomized study, worked with people who'd had spinal cord injuries for even more years than Joe. Joe had been injured for about 3.5 years when we got a chance to work with him. This individual in the next video, his name is John. All these participants are okay that we share their names and their identities. And what you'll see is John's been injured for 12 years and very similarly couldn't move his right hand, couldn't use it at all for daily activities. And we began to stimulate John. Even on the very first day, you'll notice the difference between not having the stimulator running, which is what is playing currently, unable to grasp these very light, hollow plastic ping pong balls and place them in that yellow bucket. And when we turn the stimulator on for the first time, just a few minutes later, we see that now John is able to grasp and release with his right hand, that hand that he hadn't used for 12 years, open and close the hand when he wants to, really starting to change his function. The next day we played around with the stimulation settings a little bit more. And what you'll see here is, again, stimulators off. We're challenging him with smaller wooden beads about the size and weight of a marble. He has trouble bringing his fingers close enough together to lift that marble off the table and keep it in his hand long enough to place it in the bucket. But what you'll hear in the audio here is his reaction to the first time where we got the stimulation settings just right.
Yes.
Oh yeah, that's crazy.
That's crazy.
Wow. Oops, I'll slow it down a little bit. I'm acting like I'm a pro at this now. I'm just holding it and open it. Wow.
Helping, yes.
Oh,
And this
man.
is 45. Let's go with this one if you can tolerate.
God. This is worth any kind of pain. This is amazing.
That is really amazing.
Wow. Like the other ones, like if I can get them, I'm like, they're just barely slipping out of my fingers. I can barely do it, but that's like a pinch.
So
That was really cool.
Yes. Yes.
It's even crushing.
So John worked really hard in his therapy sessions for about 8 weeks while the stimulator was running in the background. And then he came back to the lab with a little surprise for us. He had been on his own, he had been practicing playing the guitar, something that used to be one of his favorite hobbies. And just to put this video in context, because we never imagined he would play the guitar again, because as I told you, his right hand didn't move at all. And his left hand could open and close the fingers, but always all the fingers together, no individual movement of the digits. And so John surprised us with this video, and then you'll hear some of the hard work that he put in that helped him regain this function during the time that the stimulator was being used in the study.
So you start like pull what you can use into it.
Yeah, what did your thumb do before on the right side?
Nothing.
Right, you couldn't hold
It just got in the way.
Yeah.
Yeah, just like and if I focus and work at it for an hour, it's like we can strum it.
Right.
And we can get that movement going. It's like I can't do it right now. So I'll just sit there for like a half hour and just like pulling it down.
That's why that particular movement's gotten
That.
so much better.
Just do it over and over and over until it starts to get a little better. Yeah. And that's how we even got here at all. Is I just would do this like just over and over until I could get it. It started like I couldn't even make the sounds. I couldn't push it down hard enough. And start to get it, and start to do other ones, and pretty soon the chords start to come together. And I started to be able to play them on the neck, which that's like all those fingers like working together.
And John continued to practice for the next 6 months after the study, and his skill improved quite a bit. And so we've now worked with more than 7 people who have chronic spinal cord injuries, who have loss of function in their hands, as well as some who have trouble walking. And we're seeing that this spinal stimulation combined with intensive physical therapy is allowing them to regain movement, regain strength that outlasts the stimulation by as long as we can measure, up to 6 months. And we're also seeing improvements in other functions that are affected by spinal trauma. As many of you know, autonomic functions, bowel, bladder, dysregulated heart rate, other things that are common after a chronic spinal cord injury. And so we're excited about this partnership. It's really allowed us to launch into a new phase of research in our lab, and we're excited to share it with you. Thanks for listening.